And then you're gonna, like, there's nobody around, you're gonna check and make sure there's no holes in here, right? Okay? And the indicator was there, so she was right. Good for you. Perfect, that's exactly what I want, right? You're gonna take everything off your table and make it empty, right? I don't care if you put the towel on first or put the small basin on first, it doesn't matter, right? But having your table empty is a perfect way to get started, right? Yeah, and I like the way that Lindsay has brought that forward so that she can step forward, right? When she's raising that table, important, right? I don't want you doing the back first and then bringing it forward because you're going to be moving forward and stepping into something that's not sterile.
She said minor, right? Yeah.
So now, when you're looking at your instruments, this is all you have, right? That's it. These are all retractors. So you're going to only need one, right? Exactly. Yep. Now for hernia, remembering hernias, do we do a full count or just a partial count? We do a full count, and then if they go in into the perineal space, then we have to do a full count out. If they don't, then we don't have to. Now, Lindsay, it's pretty high up, right? And she's not all that tall, no offense. So when she's doing this and she's got her gown, it's too hard for her to get that out without contaminating herself. So she can ask somebody to either pull it forward, put it down, whatever. That is totally fine. If you do not think that you can pick up that tray without contaminating yourself, very important. You just ask for somebody to do it. Yep. Oh, do you need towels?
Yes.
Okay, I think I do have some towels. I think I have one more back here. Yeah. Yes, exactly, yes.
You got it right? Sorry. We leave this on, right?
I've never seen them. Oh yeah, they do have a blade. Yep. If you're opening for somebody and you don't hear, you probably heard when I was snapping this, it actually makes a snapping noise. That's this snapping breaking open, right? If you don't hear that, then it's probably not done up properly, then I would put it off.
I just want all my rakes together.
You're doing good. What's the difference in these? No idea. They're just all rakes. They're just all rakes.
Yep. They're all rakes. One's Sam.
This one goes off.
Yep. I do. But it would be fine if you left it on. It'd be fine, but I do.
What's that look like?
That looks really, really good. Yep. And then you would bring this over and unload this, right? I do want everybody to get a chance to load some blades, and then we're going to count. Yeah, those are dental, but
Those
they're
are like the ones they give you when you get your wisdom teeth.
Yeah.
yeah, yep. Okay. Yeah, that looks really good, really good. Yep, and you've got that there, and then I've put a suture here. So one of the things that I'm gonna do is we're gonna be counting, and we're also going to be loading the suture, left, right. I'm gonna have you handing a few things, okay? Oh, sorry. There's Langenbecks,
Yeah.
which is a skinny, straight one.
And then what are these names?
Those are Sems.
Sam's.
Those are 4-prong rakes and 5-prong rakes.
Okay.
And like, and you remember when you pass, right? We're gonna pass like this. I'm not gonna pass you like this, right?
Oh yeah.
Right? So you really have to think about it. And you know what? I tell new people, and when you guys are on your placement, right, you're better to take your time and do it right than to try to be fast and do it wrong, right? Because speed will come. That's not the most important, really, right? I would hand it this way. If she's right-handed, I would flip it this way and hand it this way.
So it's always facing in.
Have your needle in.
Yeah, that's a good way to
That's how I
remember it.
remember.
Yeah,
Like
good way to
left-handed's
remember it.
facing that way, right-handed's facing
And that's what I want, like, that's one of the things that I may do in the test, is say, I want you to load it left and hand it left-handed. Hand it to somebody left-handed. Or hold it right, and hand it right-handed. Or I may have you load a scalpel blade and hand it. Or a rake. I want to make sure you don't do this when you hand it, right? I want you to really feel comfortable of giving it to the person the way that they're going to use it. So of course, if you take an instrument and you're going to use it like this, then that's the way you want to hand it to the person, right? If you're going to, if they're snapping something, right, then I'm going to hand it like that, right? Right-handed, I'm going to hand it like this, right-handed. Left-handed, right? So that's something I really want you to start trying to feel comfortable passing back and forth to each other. But this is the setup, and and it's exactly what she did. She cleared off this table, right? She put this up. She draped that first so that she could get stuff off. Then she put this up, right?
Are we draping for the exam, or is it already going to be all draped?
You mean
Like
the
the
table?
tables?
I think I'll have you draping the tables. I want you guys nice and comfortable with that. Yeah. Yeah. And then if I have you lead the count, then you have to name the instruments.
You wouldn't do that though.
I might. I think I would, because I'm pretty nasty. I'm a nasty woman.
No, you just crotchety.
I am crotchety. So one of the things that
Be a big back scratcher.
I know, wouldn't it be good? This would be better though. It's longer. It's a longer one.
Sorry.
What I want you guys also to remember here at Peterborough, and I'm pretty sure that other places as well. Let's say this is the patient over here. I want you guys, when we're counting in, because we have all the sponges on one table, we can count them like 1, 2, 3, 4, 5, and then 1, 2, 3, 4, 5. So, because we count by fives, we're gonna go 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now at the end of the case, right, if we were doing a hernia and they were at the very end of the case, we're gonna have some, let's say this is the patient, we're gonna have like, let's say 2 or 3 up on the patient. We're gonna have a couple in a bucket, maybe off on the floor, right? So be very careful. Let's see, yeah, okay. Be very careful how you count, because if you do that, if you do it the way that we counted in, 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5, you have to come back here and try to figure out where you ended. So that's not a good way to do it, right? Because you can, that's where mistakes happen. So you're going to continue. You're going to start either on the floor or on the patient. Okay, so you're going to go 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. Then back 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. So it's a little different the way we count in compared to the way we count out. Okay, you know, because you're going to have he's going to have a suture up top, right? And he's going to have like scissors up top. He's going to have a tissue up top, right? So this is going to be our patient. He's going to have that stuff, and some of them like to hoard, so they'll have this like up on the patient with a Kelly, right? And so now we got to count, right? So we've got stuff on the patient, we got stuff here, and we got stuff on the floor. And let's say during the case we dropped one, right? So that's going to be over here, right?
You're a mess today.
I know, aren't I?
Jeez.
It's helping with the headache, the little
I hear
chaos,
you. I hear
right?
you.
Throwing stuff around.
Yeah, throwing
You wanna
stuff
punch
around.
somebody out?
Right? So
Hit one of
basically, in a count, you're going to start with the small stuff first, right? That's, and we want to try to get the small stuff, especially the sponges, fairly quickly. As soon as he's starting to close the perineal, then we need to start counting, because we don't want him to get that closed, and he has a sponge inside. We want to try to catch it before. So I actually randomly will, in my mind, I know that he's let's say we're doing a bowel resection. He's got the bowel out, so I know that there's not a heck of a lot left to do once he's got that problem bowel out. So in my mind, I'm gonna kind of look in the bucket, I'm gonna look on my table, kind of look up at the patient and see if it comes to 10, right? And if it doesn't, then I'm gonna look for that one, or that, because there's nothing better than saying to the surgeon, they're just starting to close. We haven't even started counting. You say, I think you've got a sponge inside. And they go, really? And they start looking, they go, oh my God, you're right, right? And they throw it off. So, you know, if you can kind of try to keep track of it as the surgery is going. It's not necessary, because sometimes they'll take like 3 sponges and throw them in at once, right? And you're just putting sponges up. That's almost impossible to do, to try to keep track of, right?
Is that how you pass on the sponges if they need it? Is you just set it right on
I
the
just set it
patient?
on the patient. I just like to set like one, usually right off the bat, right off the top. When you are coming into a surgery and you are just setting up, they put the drapes on, right? So you know that they're going to need a couple sponges right off the bat, right? So because they use also the sponges to try to retract the skin when they go to do the cut. So they need a couple with sponges. So that's one of the first things that I'll do is I'll give them sponges. I'll put up the Bovie, right, so that they can get that off. I'll put up the suction, they can get that off. Give them the light handle so they can put those up, right? And usually they'll Kelly it up so that it stays on the patient, right? So those are some of the things. I usually kind of keep them right on my bucket. If I have a Mayo, I actually put that stuff right on top of my Mayo. So I'll have my Mayo set up with my meds and all, whatever I'm going to put on my Mayo, and I'll put the Bovie, the suction, the 2 light handles, and the 2 sponges right on top of my Mayo. So that when I pull up the Mayo over top of the patient, I already have this stuff right here, so I can just start handing it off, right? And actually, a lot of the time, I can pull my Mayo up, patient's right here, right? And while I'm taking this up, because I have to bring my whole table over, they can help themselves to the stuff that they need right off the top. It's right on top of my Mayo for them, right? So it's helpful to them to do that. How's everybody for sutures?
I'd like to practice.
You wanna practice?
Yeah.
Okay. And what about for, scalpels? Loading scalpels, pretty good? Yeah? This is correct over here. What she- That's an SEMD.
That's so confusing.
So it sends.
Yeah, send.
Sends.
Okay.
So
Four.
think of the
Prong,
senders.
5 prong.
I'm trying to relate this to hockey.
And then
Bring your retractors.
this
So they were
is
called appendix. And these say
Ramses.
appendix. Short and long.
Ramses.
Short, long. Appendix, short, long.
Is that okay, boss?
And then,
Not the green gown, but you can take the blue gown.
is this Alice?
No.
Yeah. And
Pardon me?
See?
She said those are
It's
stillies.
tooth
How are you guys
stilly and then there's a
pronouncing other
non-tooth
Yeah, can you
stilly.
practice that?
So what are these?
Adsons.
Adsons. Tooth and non-tooth.
Now.
I don't know what any of these are. I forget all these instruments. What's wrong with me tonight? This one's a Russian.
These ones weren't on it, so I'm not sure what. She said these ones are stillies.
I think they're both stillies by the look of them.
Does one have teeth?
No.
So
The
these are
stillies with
stillies?
teeth.
Yeah.
No, those are Ramses.
Those
So
are
I would just
rams.
grab this by this, right? 'Cause
These are the Russians.
And these are what? These are Adsons.
Appendix.
Appendix.
Large.
Because that's how they used to do appendix surgeries, right?
I can grab it right there if I want.
Okay, let's go over these.
And you really should
So
have
this
your hands
is
kind of tucked underneath.
Stilly with teeth.
Yes,
No.
exactly.
Yeah. Yes.
So that there's no
This
way
is
that
Stilly
you're gonna
with
touch your
teeth.
shoulder.
This is
Yep.
Ramses.
You don't have to throw it right up.
Adsons.
Adsons with teeth.
Russians.
Yeah, see, and I don't, as long
That's
as I have my
round.
hands protected, I
Huh?
don't-
Yeah.
Rounded. And then that's it.
Yeah.
Like I'll just.
There was another one, but
Yeah.
someone took it. What are those?
Well, I think they're. I'm not sure if they're both stillies or not.
But if there's somebody right
One's
behind you,
thinner. I
so
wonder
you
if
drop-
one's different.
You just
That's what I
drop it
mean.
right on
I was
there.
gonna ask her.
Cause they're gonna grab it.
So did you say these are called fens?
Yep,
Oh, yeah, these
Are these
are
both stillies?
yep, one's,
Does it
oh, those
matter,
both
Doc,
are,
if you're
without
first?
teeth.
Does it
So,
matter?
but they're both stillies.
Yep, both Stillies.
Doesn't matter.
Yep.
As long as we get to the same.
Copers?
Yeah.
Yeah.
And are the rest of these just like 4-prong and 5-prong rakes?
Right.
Okay.
Really?
Right angle?
And
Ribbon and ribbon. Yeah.
How was that?
What fancy tools are in the mastectomy tray?
Yeah, I don't remember those. I don't think I was here for that.
But you fixed it.
We're doing that too.
You were the one that did it, not me.
There's no ladies in here.
And ribbon. Like a ribbon.
You're welcome. You want to tape it?
Can I pass it to you?
We want to Snapchat you.
Right?
Let's practice gowning.
I'm left-handed.
Let's practice passing the rings here this year.
What size gloves are you?
Handy, right?
Right?
Wait, I'm just wondering what's I know
My right hand is busy.
Being left-handed is screwing me up.
I think you should hold it like this and just straight down.
It's not like I know it's not.
And then you got it, and then you clamp it,
straight down.
right?
What's their final exam?
They
Yeah,
don't know.
please ask.
They
Go
don't know.
ahead. Tell them.
Well, it'll be gloving, gowning, so make sure that you.
Like, you want these like this, right? You're gonna pass the handle to,
Okay. Just
Thirty,
grab it by
right?
the end.
yep, grab it by the end.
Cool.
And left, that way.
That's easier than the instrument.
Yeah.
Yeah, because you're far away from the from the doctor. The closer you are to the doctor.
He won't,
He won't.
because he'll be wanting to
Yeah.
hurry the hell up. Let's go.
Yeah. Hurry the hell up. And chances are, the first time it'll be like this.
He'll just grab it by the elbow and grab it.
First, 1, 2, 3, and 4.
And then you count these as a whole.
And this.
And that?
So 1, 2, 3, 4, 5 is the sheath, and then this is a reducer.
Okay.
Okay?
So
There's 3
4
parts to this, right?
No, that doesn't
'cause
come
this-
off.
So just one
Oh, this,
part?
yeah, the rubber, and then just this.
So 6 gaskets, 4 trocars, and then
5
5 of
sheaths.
sheaths.
Yep.
And then
So
1
it's
reducer.
1, 2, 3, 4, 5, and then your rubbers are 1, 2, 3, 4, 5, 6. Sorry, 1, 2, 3, 4, 5, 6. Right? Trocars are 1, 2, 3, 4,
And these
And
are
this is
three bits
ridges.
again?
That's 3 pieces.
3 pieces and
And
one.
one. Yep.
So dumb.
I know. Yeah, because it does come apart, but it's very hard to come apart, but it does come apart. Yeah.
Okay, that's cool, because there's multiple stickers.
No, what I do is I label all my fluids. So usually on a lab pulley you get normal saline and you get Marcaine or something. So I would put Marcaine on here, 0.25 with epi, and I would put it right on my syringe that I'm filling. I'd put it on the one that they put it in, and then I would put normal saline on the, and then I would get rid of them. There's usually you have a little bag here. I just put them in the bag.
Okay. Do you have any like info on like OR pharmacology? I feel like I know not much about it before placement.
There's not a lot. There
No.
really isn't. And
What is it usually?
some of the things that, so usually locals, right, for pain. So they do lidocaine, they do Marcaine,
With epi though?
yeah, with epi. And then there's Marcaine without epi, right? So it's just a preference of the surgeon.
I want to look up OR pharmacology because I feel like I don't know enough about it.
Yeah, there's not a lot.
So sorry, it was Marcaine with epi, Marcaine
Without
and
epi.
what was the other one? Just local?
Lidocaine.
I know what that is. Okay,
Yeah.
that's nice.
Yeah. And then the anesthetists, they have their own, all their
Yeah,
own.
but we don't worry about
No,
that.
we don't worry about that. And then, the only other thing is, we have clotting agents. So that if there's like a bleed, that we have different things that we use, laparoscopically, open and everything,
Is there
right?
like a class I can look up? Like what's the class of those?
There's fibular. It's called fibular. There's,